Good day and welcome to CSN 24 News TV. I'm Lena, bringing you the latest updates from around the nation. We turn our focus to a major disruption in the US Medicaid payment system that has caused significant concern among state officials, healthcare providers, and millions of beneficiaries. Earlier today, the online portal used by state Medicaid agencies to receive federal funding abruptly went offline, leaving officials scrambling for answers. This system outage, which temporarily disrupted the flow of federal Medicaid payments, raised immediate concerns over potential financial strain on state-run programs that serve millions of low-income Americans. Hospitals, clinics, and doctors that rely on Medicaid reimbursements were left uncertain about the continuity of payments. A memo from the Office of Management and Budget reassured the public that the Medicaid program would continue without pause. White House Press Secretary Caroline Leavitt confirmed that the administration was aware of the outage and was working swiftly to restore access. States are still providing benefits, and doctors and hospitals are still receiving payments. We have confirmed that no payments have been halted. They are still being processed and sent, Ms. Leavitt stated in a post on X. By the afternoon, some states, including Connecticut, reported that they had regained access to the portal. However, concern remains high, particularly as the beginning of the month approaches. Many states receive a substantial influx of Medicaid funding at the start of each month. And with February first falling on a Saturday, state officials worry about potential payment delays that could arise if the portal remains unstable. Experts warn that if the system remains down for an extended period, it could create a cash flow crisis, delaying payments or forcing states to issue partial reimbursements. Medicaid, which provides health insurance to approximately 1/5 of the US population and accounts for roughly 10% of the federal budget, is a critical component of the nation's healthcare safety net. Any disruption in its funding mechanisms could have far-reaching consequences. While the current outage is reportedly unrelated to broader political measures, some officials remain cautious, especially given ongoing legislative discussions about potential Medicaid funding cuts and proposed work requirements for beneficiaries. Adding to the concern, federally funded community health clinics, which provide essential medical services to over 32 million low-income patients, also rely on federal payments processed through the same system. The National Association of Community Health Centers reports that roughly 2/3 of patients at these clinics are enrolled in Medicaid or similar publicly subsidized insurance programs. Any disruption in funding could lead to service reductions, layoffs, or even temporary clinic closures. Melissa Mather, spokesperson for Family Health Centers in Louisville, described the situation as chaotic. She noted that while some clinics have cash reserves to endure short-term payment delays, prolonged disruptions could have devastating consequences. A recent survey by the Virginia Community Health Association revealed that some federally funded clinics might be forced to close within 2 weeks if their funding remains uncertain, while others could face staff layoffs, particularly in outreach programs serving homeless populations. Senator Ron Wyden of Oregon confirmed that Medicaid portals were down nationwide, and New York Attorney General Letitia James stated that her state had been locked out as well. Meanwhile, a notice posted on the Medicaid payment portal indicated that additional measures were being taken in compliance with executive orders concerning federal grant payments, though specific details remain unclear. As the situation continues to unfold, healthcare providers and state officials are calling for swift action to restore full functionality to the Medicaid payment system and ensure uninterrupted care for millions of vulnerable Americans. CSN 24 News TV will keep you updated as more details emerge. Stay tuned for further coverage. I'm Lena and you're watching CSN 24 News TV. Stay informed, stay ahead.